We're talking about a lot of concepts today, things to do, preparation, training, stuff like that. But there's another side to it on cybersecurity, and that's leaders who have to deal with the possibility of a cyber attack, the possibility of something going wrong, and the aftermath of when something does go wrong. So I'm going to bring up Tad Gary, who is the CEO of MercyCare. I was doing a little research, and he is responsible for nearly 500,000 lives of people with special conditions, vulnerable populations included. Next, I'm going to bring up Dr. Shar Najafi-Piper, who is the Chief Executive Officer at Copa Health, has been for 5 years, and in addition to being completely focused on our technology, she's also very innovative, and innovation sometimes is disrupted by cyber attacks. So I think, Tad, you're at the end there, and Shar, you're right here.
What should I sit down?
Welcome.
Too.
Thank you.
So,
Thank you.
So, Tad, you've been part of the system for many years. You've been a leader, and especially in different positions at MercyCare, and now you're the CEO. And a lot of changes. I remember when I first got to Arizona, I first got working in this field, technology was something that was just plowing forward, and now it seems to change even at a faster rate. So tell me a little bit about your history with MercyCare, and also how the introduction of technological advancements, I always say advancements because sometimes a lot of people think they're painful, has affected the work that you do.
Yeah, absolutely. And first I want to thank everyone for coming here today and really centering themselves on such a really, really critical topic as well. And want to thank the COPA team too, led by Shar, and for helping to put this on and really doing important work out in the community. So just a real quick on, I know Norm spoke just briefly about MercyCare, which is the organization that I have the opportunity to work for. It's a local Arizona-based health plan that's a nonprofit designed to provide care and support to individuals within the community at about 450,000 covered lives that we have, and many of which are considered special populations, individuals with intellectual disabilities, individuals with mental illness, others with chronic health conditions. So a range of individuals with a range of needs as well. So I've been fortunate to work at MercyCare for now, I can't believe that's 18 years. It is incredible when I think of that. And also, I wonder my age too as I talk about that too. So anyways, and I've been in just about every role at MercyCare. So finally, the board of directors ran out of positions and gave me the CEO title. So here I am talking in front of you guys. But as Norm stated, with regards to the question, technology and the advances over the last 20 years, and thinking about 20 years ago and before, when we think of technology, things have expanded and blown up over the last 20 years. It is really incredible to think about that. Previously we were a very paper-based type of organizations out there, especially in the healthcare field, care coordination. So docs talking to each other, or, records being shared, all were done not in a way that is very convenient, especially for the healthcare providers, but most importantly for the patient as well. And so the advances now, when you fast forward 20 years, pretty incredible. You have many more individuals using electronic health records. You have a lot more opportunities to share data. We are also have deployed over the years various different analytics to help predict member risks. So the risk of displaying certain chronic conditions and things. So really using that has been incredible to see where we're at this point. So lots of changes, lots of opportunity for efficiency. But with that said, still a lot more work to be done in this space. So.
I'm going to ask Shar this question, but I'm going to want answers from both of you. In your roles, what are your biggest concerns about the use of technology? You mentioned electronic health records, but other technology moving forward with the populations that you serve in healthcare.
So first, before I answer your question, I did want to give recognition to our own Copa Health Techno Wizards. Without their assistance and their support and their ongoing expertise around this area, I don't think we would be where we are today to be able to host a conference related to cybersecurity. And so thank you for all your efforts and the way in which you support us. I think it goes without saying that you have to have a strong infrastructure, not only current systems, but also fast forward looking at future systems and ways in which you can take an antiquated system and advance it without losing the ethics behind it. And so that's an area that we're always balancing at Copa Health. One of the areas for me being, I think, kind of quasi techno wizard-ish. I do try to stay very up to date with AI technologies, with technology advances related to healthcare, really making sure that risk stratifications protocols, as Tad just brought up, are really embedded into the work that we do within a healthcare system, because we don't want to be at COPA a reactive system of care, right? We want to be proactive. We want to determine when we feel like our members are getting to the point where they need a higher intensity type of service structure. And to do that, we need good technological advances. And so we have brought on a very strong infrastructure at COPA to be able to do those types of risk stratification protocols, to be able to layer in good service structure for our members, really determining how we're doing from a quality perspective. That's all our IT team, in the ways in which they're extracting some of that data for us and allowing us the opportunity to analyze and then just make some operational changes related to the work that we do. So that is just, I think we're very unique. We're a unicorn within the space because of this team. So I just wanted to highlight that piece of it. Again, the other side is the ethics behind using some artificial intelligence to be able to drive some of the administrative burdens that we have within the healthcare system. We have to be able to automate without going fully the technology route. And so that balance of providing the service to the people that we serve by way of also automating what we can has been certainly a topic for us at the organization.
It's interesting when you talk about AI. It's very similar to when I first started at COPA, 400 years ago. And they told me we need an electronic health record, and so many people kept saying, no, we're not going to do that. AI is here, and it's going to be part of it. So, Tad, is that one of your concerns too? I mean, Shar brought up a great example. The world is not going to stop because we want healthcare handled differently.
Yeah, I think, from an artificial intelligence perspective, there's a little bit of a blessing and a curse at the same time, right? And Shar did a nice job of raising, one component of it is the ethics of it and making sure that the data by which AI is being used is secure, is private. We have a responsibility. This is, especially in the healthcare space, it's about patients. And when we think of patient safety, we many times think of, doctors and nurses and having safe protocols. But we also need to think about that from a technology perspective, in particular, artificial intelligence, and making sure that there is good data and security around that, as well as, the ethics, as Shar had mentioned, making sure that those ethical guidelines are in place and monitored regularly. I think that is a really, really critical piece. But I will say artificial intelligence is, I think we'd all agree, it's here to stay. And some wonderful things have occurred through artificial intelligence, more than I had even fathomed, is what in the past it was, a little book that was written by someone and you're like, I don't feel like reading again on this. It's just going to be a fad. And then sure enough, it's a huge impact. And I think it has great opportunity moving forward.
Yeah, so back in the day, the only thing they did with movies like 2001: A Space Odyssey is scare us. They didn't give us the positives. So, with all the things that we're talking about, there have been situations, cyber attacks, data loss, hostage situations, which we talked about a little bit earlier today. How do those types of incidents affect Mercy Care? And then I'll get on to Shar, but also I know a lot of companies that I've connected with this past year that are much smaller had a much more difficult time getting past some of those things. Yeah, I think when we think specifically in the cyber realm, the cyber attacks are a huge risk. And we've seen in the news, even as recent, that there's been some pretty significant cyber attacks over the last year or even two, or actually longer. And so that becomes a huge threat that needs to be monitored. Organizations, really it could take down organizations at this point. We are so technology focused, and a lot of our work is dependent on that, such as electronic medical records and data sharing that occurs. That technology plays a huge role. And with that, we need to have proper procedures, plans in place to really monitor and really reduce those threats as much as we can. So it's really important. I know Mercy Care, we have significant efforts in play to continue to monitor it. We have to train significantly. I think one of the biggest factors that we see in cyber attacks is the human element, the individuals opening up the phishing emails or really, kind of falling for some of those ploys that these bad actors do. And so the human element is such an important aspect. I know you can do a lot of work on the technology to help circumvent those attacks, technology related, but the human piece of it still continues to be a huge issue and hurdle that we have to keep watching very closely. Yes, Shar, so when we talk about that, and we all have heard about social security numbers being stolen, or companies having their databases basically frozen and held up for ransom. But there's also things like power outages and data corruption from other places. Tad mentioned the users. At Copa Health, I know a lot about what our IT group is doing. I love them. They're great people. But how do you feel that sits in our priorities of things that we need to keep paying attention to?
So Tad mentioned phishing emails, and I got chills down my spine. I don't know about you all, but I'm very hypervigilant of every single email I receive. I never used to be that nervous about opening an actual email to review it, to see what the content was within. Please don't ever click the link. Anytime it's suspicious, please do send it off to your IT wizards, and they will figure it out for you. I believe on any given day, maybe 3 to 5 times a day, just depending. I do send a lot of those phishing emails over to our team just to ensure that it's not a fake one. And believe it or not, 95% of the time it is a fake email. And so from that perspective, about 5 years ago, had you had a conference on cybersecurity, I would have no context for you. Now, I do have context for you. I would say at the organization, currently we're about 1,250 employees across the company. We have over 100 facilities. We have our own employees who I connected with earlier who said, I didn't even know you guys had this conference. So I share that because it is really, for us, is really challenging to communicate all that we're doing from an infrastructure perspective to all of the employees all the time. And so our IT department has done a beautiful job of doing these test phishing emails as one example. And if you click it, I don't even know how many years of your life you have to spend doing trainings on never clicking the link again. And we joke about it, but honestly, it is a very basic way in educating and armoring our staff to ensure that we're not held hostage, that our systems don't shut down, and we're not in a situation where we are spending our wheels trying to get our operations back online. And so I recognize and thank our team for all the risk mitigation strategies that we have in place as it relates to cybersecurity. And for those who don't know, if you don't have good cybersecurity in place, you won't get insured these days, right? So your insurance also has to have cybersecurity officers, which this phishing email component of it is a big component as it relates to the strategies that you have to have in place to solve for those issues that come up.
You know, it's interesting. Anybody who knows me well knows that sometimes I'll use 15 words when it can be said in one. But in my emails, I've started looking now and making sure, because every once in a while I'll type out an email and send it off to somebody or getting ready to send it. And I'll think, this doesn't sound like I even know them. So I always try to do that. But so, Tad, what can Mercy Care and organizations like Copa Health do to ensure cybersecurity? I know we talked a little bit about insurance. We talked about protocols. We talked about the human element. But what else do you think organizations should be doing?
Yeah, well, one, I think you need to have a plan of attack. So you need to have a multi-dimensional approach that touches on a lot of the things that we've already talked about up here, one of which is, that constant, well, one is just to have that plan and a written documented plan that contemplates, the various different scenarios that can play out depending on the various, different types of cyber attacks. So I think having exercises around the development of that plan and kind of working that plan, that I think many of you guys as professionals do that type of work and know that work very well. But definitely doing it around cybersecurity, I think is really critical. But as I mentioned, having that multi-dimensional plan, so really looking at it from many different angles. Obviously, having ongoing monitoring is very important, and security is in place to really help prevent that. But again, and not to overemphasize, but it's really that human element and making sure that you're constantly reminding folks, including ourselves, of what that may be, because those are changing by the moment. It's hard for someone like me. I have a lot of salespeople, good intention, they're doing their job, they're out selling. They like to use a lot of emails. And so I get a lot of emails from salespeople that are, just out there, like I said, doing their job. But those are, things that are clouding the emails as well. And so really it's forcing myself and others to be very, very vigilant. And these bad actors, as I've called them, are very equipped and are very intelligent themselves and know a lot of different ways in which to do it. And it's not just emails. I get, unfortunately, quite a bit of texts from different folks phishing, saying, act like my chief medical officer who needs to know how he's going to get paid next week. I know that's not the case. We know how we get paid. So why are you asking me that? But I know this and don't fall for that kind of stuff because of the training and that ongoing training, particularly for that human factor, I think is one of the biggest pieces to really work through.
Yeah, I think bad actors, as you put it, have helped educate people at Copa Health. I've gotten many emails from SHAR that SHAR had nothing to do with, and you come to recognize those things. So, when we're talking about this SHAR, Tad mentioned planning, and we talked about planning earlier, and I just think it's amazing that we have two CEOs who realize that planning for these things has to be at the top of the org chart when you are looking at priorities.
I absolutely. And I wanted to add too, related to the training piece, I think it was maybe 6 months ago or so, I had sent this blanket email asking our staff to never, ever, click on a link, but also I will not be emailing or texting asking for money, right? There are policies in place, there are procedures in place, and that is not anything I would ever do. And I know we have a lot of COPA staff in here, so please know that. None of our executives will ever reach out to you asking for money. That is not something that we are able to do legally and ethically, nor will we do. And so I share that and we laugh because there have been situations where employees have been attacked. And they have gone as close as to going to the store to get these gift cards, and they have stopped in their tracks. And so it sends them down this path of training. So again, it really does go to educating our staff and having a non-punitive, psychologically safe place to say, I think I made a mistake here. I did click the link. I did go to the store. And for us as leaders, not to punish them for it, but also continue to promote better education and more training for them.
Yeah, I know Tad touched on this earlier, so I'm going to ask this question in a way that, Shar, I want you to answer first, and then Tad, but what do you think is more important in cybersecurity and security of our systems? Technological advancements and safeguards, or the training of actual human beings?
Can I say both and?
Yeah.
Am I able to? Because I do think from, a healthcare perspective, look, we talked AI in the beginning of this discussion. I think we're if you take a look at the continuum, healthcare is way behind on the AI side, right? And only because we have a lot of federal legal requirements of providing the service that we provide. And so sometimes that limits us as healthcare professionals. So we're just barely starting to touch the surface around AI. But we have to, because we also do need to create better efficiencies within our healthcare system. We have to have a better way in which we are assessing and diagnosing and treating our members and finding just more unique, efficient ways to be able to deliver the care. AI will never replace the human beings within healthcare. It just is not going to happen. We are there, we are trained to deliver that service, but we do need some technological advances to be able to provide more efficient care. With that being said, simultaneously, we do need to educate and really make sure that our staff feel supported and our community feels supported in this movement. While also, I would love maybe next year putting a plug in for you, talking about the ethics behind everything that we're doing from a technological perspective. Yeah,
ideas for future conferences start now. And so that's a great thing to talk about, because ethics is a very important thing. We might take a few questions in a minute, but before we do, I wanted to ask both of you, Shar first. And we're talking about cybersecurity, and we're not talking about drinking too much coffee, but what keeps you up at night when it comes to technology and cybersecurity?
So I have 2 little boys, so they do keep me up, not because they're stressful, just because they're active boys. From a cybersecurity perspective, I do have concerns about, as I mentioned, because we have a large employee base, not everyone being armored with the education and the training that they need, so that they don't get attacked by someone who's really deliberate and brilliant in the way in which they're going after that individual. So that is of concern to me. But I would also say I also rest well because of the infrastructure we have in place at COPA. Our team has done a remarkable job of creating that infrastructure and modifying and changing it as we go, so that we're not just sort of creating a plan, to Tad's point, but not revising and modifying the plan as we continue to do the work that we do.
And as Shar mentioned a little bit earlier about the IT team at Copa Health, I will say one thing. They don't make you afraid to admit that you've done something in error. And I think that's important too. But
can I mention one more thing? So not to go backwards, but when we were talking about this particular conference, Norm reached out to me and said, who would you like to have on the panel with you for your part? And I said, Tad Gary from Mercy Care. And he said, okay, tell us the rationale, the why behind it. And I said, well, of all the health plans that we work with, Mercy Care is the health plan that has the expertise around vulnerable populations, and that is our niche in the community. In addition, whenever there is a cyber attack on let's say a claims processing system, they were the most immediate as it related to working with us to resolve any issues. And so when Tad talks about that plan and really being able to execute the plan, I recognize him and his entire team for just their immediacy around making sure that we had those issues resolved, so that it didn't continue to create any more angst at the company. So I wanted to mention that before we end.
So the building of a great team and foundation, that's something that both these organizations have done. But Tad, I have to ask you, what keeps you up at night?
Yeah. Well, definitely espresso that I use throughout the day, and a 1-year-old German Shepherd that I have. He's a feisty guy. But all kidding aside, one of the things that, thank you, Shar, for that. And I think a lot of that pre-work and our due diligence on really addressing cybersecurity threats that we have really has played out in the way in which we're working with our providers and members. So thank you for that. The one piece that really I struggle with in thinking about this is, we we have a duty and responsibility to care for members and families. And sometimes getting members and families to connect to care can be one of the most difficult things to do as a healthcare organization or provider. And as we have more and more security attacks and threats, the trust that members or patients and their families have in the healthcare system can be seriously compromised. And that really creates a challenge for me as I look through and assess how things are going and what's being done out there. And so that is probably one of the biggest elements that I struggle with, is how do we ensure the safety, make sure folks are trained, as well as, the patients and families are trained, but that ensures that they get the services that they need when they need it.
I know we're getting close to lunch, and I see that somebody set some Copa cookies over there that we're going to raffle off in a little bit. But we do have a few minutes. Does anybody have a question that they would like to either ask Shar or Tad? Right back there.
Thank you.
Softballs.
So I saw in the news that Microsoft has created Copilot, an AI that's being used in hospitals in Taiwan. And I was wondering if you foresee that being used in hospitals in Arizona.
Yeah, and Copilot's definitely built around AI in particular. And I do see, I will say as an organization, we've already deployed a few places for AI to exist. And so it's doing work for us right now, actually, as we speak. And we're looking to evolve that even further. So I do see AI even at the service level, like with healthcare providers, and it's already being deployed to some extent, but it will be even greater moving forward. I think there's great opportunity. I think healthcare providers, are going to take some time to adopt it. But I have already seen a lot of excitement too around it. But as we mentioned, there's pros and cons to it. And I think, with any new thing, we have to be very mindful of how we deploy things such as Copilot in the healthcare setting.
Shar, how do you feel about the implementation of AI in diagnostics or treatment of the individuals we serve?
Well, that's a good question. I was just going to say we don't provide any surgeries at COPA, so I'm going to dodge that question. I do think, just as a psychologist, I would say that there's a lot of variation in diagnosing. And so any tool that can help to standardize that particular process, I'm in support of, as long as it's done with ethics.